Trial of cannabidiol for drug-resistant seizure in the Dravet Syndrome. Dravet syndrome is a rare catastrophic lifelong form of epilepsy that begins in the first year of life with frequent and prolonged seizures, previously known as severe myoclonic epilepsy of infancy.
Dravet syndrome is an epilepsy syndrome associated with an intractable seizure disorder and cognitive and motor concerns that's highly associated with a sodium channel receptor mutation. And about 70 to 80% of the children with the diagnosis of Dravet syndrome will have a positive SCN1A mutation. However, the syndrome at this time is still considered a clinical diagnosis. Typically, the children will have the seizure onset in the first year of life. Prior to the onset of the seizures, they will have no concerning medical history of normal development and a normal examination. The seizures that occur in the first year of life are most often convulsive seizures, either full body tonic-clonic seizures or grand mal seizures, or the jerking that just involves half of the body, or hemiconvulsions. These seizures, especially in the first year of life, are often prolonged and very difficult to stop. After the 1 year of age, you'll often develop many other types of seizures, such as atypical absence seizures or staring spells, myoclonic seizures, which are quick muscle jerks, and other partial seizures. The seizures are very difficult to control, tend to be intractable to multiple medications or other epilepsy treatment therapies. In addition, after the onset of seizures, you can start having developmental or cognitive issues arise.
The Dravet syndrome is a complex childhood epilepsy disorder that is associated with drug-resistant seizure and high mortality rate. We started cannabidiol for the treatment of drug-resistant seizure in the Dravet syndrome. Common issues associated with Dravet syndrome include prolonged seizure, frequent seizure, orthopedic condition, delayed language and speech issues, growth and nutrition issues, sleeping difficulties. The application in medicine determining if cannabis used in conjunction with anticonvulsant medication is more effective in decreasing the number of seizures compared to treatment with only anticonvulsant medication in children 5 to 15 years of age with seizures.
In this study, we treated children with Dravet syndrome, which is a very serious genetic form of epilepsy that unfortunately has a very high seizure burden and a very high mortality from epilepsy, that these children who had not responded to often 5 or 10 other treatments were given cannabidiol or a placebo in addition to their existing medications. Cannabidiol is the major non-psychoactive ingredient in cannabis, also known as marijuana. So cannabidiol does not produce any high or psychoactive properties and therefore has less potential side effects, especially for use in children, than a psychoactive compound such as THC.
We were in the double-blind placebo-controlled phase of the study, and we did that for 14 weeks, and we were totally convinced that she was in placebo because her seizures didn't change at all. And then we were able to roll into the open label extension, and the second day that we were in open label and we knew that she was getting the actual drug, she went seizure-free, completely seizure-free for 2 months, which has never happened.
The main findings of the study were that there was a very statistically significant reduction in the convulsive seizure frequency in patients who were randomized to cannabidiol when compared to patients who are randomized to placebo. So the message is that cannabidiol does work in reducing convulsive seizures in children with Dravet syndrome. My hope for the future is that this study will lead to more similar studies to assess cannabidiol and perhaps products containing both cannabidiol and THC in various forms of epilepsy.
Cons. The effects of cannabidiol include dry mouth, high blood pressure, disorientation. Pros. The cannabidiol has been used in clinical practice to help relieve seizure, inflammation, nausea, and other health problems. The cannabidiol is used as an anxiolytic, antipsychotic, anti-epileptic, neuroprotective, vasodilatator, and even has means to stimulate bone growth.
There is no set treatment protocol in the United States for Dravet syndrome. In France, there is a specific treatment protocol that they use consisting of valproic acid or Depakote, followed by clobazam, which is also called Onfi, followed by stiripentol. The medication that has the best medical literature for effectiveness in seizures in Dravet syndrome is the stiripentol. It's the only medication that has been shown to be effective specifically for this population in a randomized placebo-controlled trial. In that trial, of the 21 children who received the stiripentol, 15 had a reduction in the convulsive seizures, and 9 of those 15 were seizure-free, at least for a period of time, as opposed to the placebo group where none were seizure-free and very few had any sort of effectiveness. So we know stiripentol can be effective for seizures, especially the convulsive seizures. In that trial, all the kids were already on the valproic acid and the clobazam, because again, that is the typical French protocol that is used. The next medication outside of that triad of medicines that have the best medical literature suggesting they are effective in Dravet syndrome is clearly Topamax or topiramate. Again, a very useful medicine, especially for convulsive seizures, both in decreasing the length of the seizure as well as decreasing the frequency of the seizures. Other medicines that may be useful in the literature include levetiracetam, which is Keppra, sonisamide, which is Sonogram, bromides, as well as the ketogenic diet.
Issue a plate in Ecuador. To assess the potential effects of cannabidiol, a recent trial randomized 120 children and adolescents, mean 10 years old, with Dravet syndrome and drug-resistant seizures to cannabidiol oral solution 20 mg/kg diet versus placebo in twice daily doses for 14 weeks. The percentage of patients who have at least a 50% reduction in convulsive seizure frequency was 43% with cannabidiol and 27% with placebo.
Video. Haley. Do you see her lips going blue? Mm-hmm. Haley. Haley. Okay. Okay. Stay on your side, baby. Oh, shh. Get ready. What time is it? It's been going for what? Like almost a minute?
30 seconds. Yeah, a minute.
Okay, if it goes longer than 5, grab the medicine. Oh, sweet girl. Okay. Okay. Is she okay?
You need to hold her more on her
She's
side.
going bluer on hers.
Put her more on her side, not sitting up. Like lay her on her side, not sitting up.
I just want to hold her. Okay. Okay. Nate, her feet are... Hey. Oh, Nate. She's drooling like crazy, this one, too.
Yeah.
Hey, sweet girl. Hey. Sweetie. Go grab the medicine. It's starting to get worse. Yeah, I need the medicine.
Conclusion. Research articles indicate cannabis has potentially beneficial anticonvulsant properties, and this reducing the number of seizures in children. In the syndrome helps to have a normal life to help children who suffer it.
A study out today found a new treatment for epilepsy is showing great promise. It uses an extract of marijuana. Here's Dr. John LaPook.
You're going to go to school.
From age 1, Hank Kovac suffered from severe epilepsy that could not be controlled with medicine. His mother, Megan, says in one day he could have more than 25 seizures.
I thought he was playing in the other room. He was not playing in the other room. He was convulsing, turning blue, and that's when I thought I lost him.
He's been such a good boy getting them all hooked up.
Last summer, she eagerly enrolled her son in a small trial designed to see if medical marijuana could help. Twice a day, Hank receives a marijuana liquid extract called Epidiolex. The medicine does not contain THC, the ingredient that can cause euphoria, anxiety, and paranoia. Megan says the change has been dramatic.
We instantly saw results. He was smiling again. We noticed the decrease in seizures. He was able to transition. And at this point, he was finally able to gain cognitive skills.
137 children and young adults, average age 11, were given the drug. After 12 weeks, parents reported the number of seizures declined 45 to 50%. Dr. Linda Locks of Lurie Children's Hospital in Chicago is one of the researchers.
Some of the kids clearly became more verbal, better coordination. I had one child who started walking while they were using the medications.
Where's Harold the helicopter?
Hank's epilepsy was so severe, at age 7, he still cannot speak. But he's able to attend school and has not had a seizure in months.
My goal for him is to hear his voice, to hear him talk. We just want him to be happy.
It's been known since the early 70s that the active ingredient Hank received, called cannabidiol, can block seizures in animals. But how it works is unclear. What is clear, Scott, that much more research is needed, especially placebo-controlled trials. Promising news. John, thanks for that.